Yeah, there. Until you have it looked at, kind of thing. Yeah, I know what you mean. So in this clip, you'll clearly see me bring Charlotte's heels towards her buttocks or up towards her low back. The right hand heel doesn't go as far. There's resistance earlier as I'm trying to move Charlotte's heels up towards her buttocks, signifying to me that there's a right side dysfunction in her pelvis. In this clip, you will see when Charlotte's legs are laid flat, the right heel appears to be higher up or shorter than the left. Now, this again symbolises or signifies to me as a chiropractor that there's some dysfunction in Charlotte's right-hand side of her low back or pelvis. That's often the way those now you don't. I feel great, and then someone pokes it and it hurts. Don't do that. Ow. Okay, and into the treatment we go. So first thing you'll see me doing is lowering Charlotte's feet downwards, so they are now lower than her low back. This is often very comfortable for people with low back pain. Not always, but often. Charlotte has had quite a lot of injuries or issues in the last few months with some prolapsed discs, which have caused her a lot of discomfort. We're coming out the other side now. She's feeling a lot better. But that position while I'm doing some muscle work really helps Char. Right now, you will see me working on Charlotte's glute muscles, not the big one, which is called the glute max, but a slightly different one called the glute min and the glute med, which are the middle and small muscles, very tight on Charlotte's right-hand side, and they will be affecting the presentation. Okay, and now we're doing some work on the muscles in Charlotte's low back on the left-hand side. I've cut some of the muscle work I did with Charlotte out of this video, otherwise it would be very long, but we're working on her paraspinal muscles now, which often hold a lot of tension to stabilise the spine when you're in pain. Just a little recap on Charlotte's presentation. As I mentioned earlier, she has had some issues recently with some discal prolapses. They were causing a lot of discomfort, not only in the low back, but the pain was also travelling down the leg of Charlotte, and that was hampering her probably as much as the back pain. Okay, breath in, chat. And all the way to me. Perfect. After a nice adjustment of Charlotte's middle back, we're just doing a last little bit of muscle work just to make sure everything's balanced before we move on to a technique called flexion distraction. So, finishing off the treatment now with a technique called flexion distraction. As you'll clearly be able to see from the clip, I am mobilising Charlotte's low back. Because she's laid on her front and not initiating the movement herself, I'm able to control quite specifically where the movement's occurring, and it's nice and gentle and focused. This technique certainly is a firm favourite for patients. When you are suffering low back pain and is feeling restricted and tight in that area, the flexion that this position offers is often of great comfort for people. So, moment of truth, heels move up to the buttocks nice and evenly, and when I bring them back down, they are level, showing that the imbalances that were there in Charlotte's back and pelvis are now being addressed.